Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 139,747 confirmed cases of COVID-19 in Canada and 45,383 cases in Ontario. Chatham-Kent has 366 cases and Sarnia-Lambton has reported 343 cases. Michigan now has 113,863 cases, with 14,112 cases being in Detroit. Today, we are reporting 2,613 cases of COVID-19, an increase of 5 cases from yesterday. 1 is a close contact of a confirmed case, 3 are community acquired, and 1 is still being investigated by our nurses. 2,442 cases are now resolved, and 95 cases are active and being followed by our staff. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 3 retirement homes currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. The ministry has released their new assessment tool, which can be accessed through our website or ontario.ca. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Parents are being asked to attend the St. Clair College Sportsplex for testing if needed. Windsor-Essex has 3 assessment and testing centers, including the St. Clair College Sportsplex, Windsor Regional Hospital, Olette Campus, Erie Shores Healthcare in Leamington, and Sohack in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick online access, you may receive your result before the health unit contacts you. Please continue to visit our website at wechu.org for the most current information on schools and workplaces. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again. Recently, we talked about private parties and the resulting community spread in not only in our region, but in the other region as well. So as another example, we investigated a cluster as a follow-up to another cluster, the previous cluster that we reported. So this is a new cluster that we recently figured out, and also wanted to share that as an example of how the community clusters initiated and how it spread across the community. Am I good, Mark? Yes. All right. So what is a cluster investigation? It is a systematic process to identify an unusual aggregation, whether we are talking about a real perceived health events, and in this particular situation, obviously, we're looking more for COVID that are grouped together in time and space and that are reported to the health agency. So even if we are getting one report and then we build up on that to assess all the contacts for any possible infection with COVID-19 and trying to identify the similar exposures using the time and place for those type of events. And as a result, what happens is we try to isolate all those individuals who are part of that similar exposures and to prevent any further exposure and transmission in the community. And in addition, if they need any type of care or any testing is needed, whether we're talking about all the contacts or anyone who else is exposed, we take the appropriate action with that respect. So from a COVID perspective, who are those contacts? So contacts are those who have shared living space with a person with infectious COVID disease, and that's why the infectiousness of the individual is important. When our team is doing that investigation, we are looking at the time when this person started showing symptoms, and then based on that assessment, we go all the way back up to 48 hours to identify a potential infectiousness period. And this may include anyone who had exposure in so many variety of ways, whether we are talking about household contacts, friends, co-workers, or in other congregate settings, whether in different areas. So I'll just go back and review some of these slides, which we have reviewed a few times in the past, in the interest of ensuring that everyone do understand the concept of contact tracing. So when we get a positive case reported to the health unit, we initiate our contact tracing, and as a result, let's say it shows up that 5 individuals are potentially came in contact with that individual, and let's say 4 of them are exhibiting symptoms, and then all those exhibiting symptoms, they're advised to go for further testing, and let's say, for example, 3 of them came back positive after that result. And then we further continue on our investigation to identify other contacts, and then based on the other contacts, we identify who is symptomatic, who is asymptomatic, who need to be in isolation, and how the isolation should continue. And then based on that, we then see more cases that converts from either symptomatic to a confirmed case. The idea of all this contact tracing is to break that chain of transmission. So we try to eliminate the chain of transmission right from the beginning. If we can identify the case immediately, and if we can identify all the close contacts with the potential exposure, if we can prevent that at the right level, we can contain the disease in a timely manner, and we can prevent the spread further in the community. So that's why it is really important that people who are exhibiting symptoms or are concerned about their symptoms, if they are tested, if they are advised by public health to share all those details of their contacts and all the potential exposure areas, we can act immediately and we can prevent the disease from spreading further. So looking at what we have uncovered based on all of that investigation is another community cluster that we are identifying, and I recognize that the slide is busy and with the fonts that are maybe not be as big as people may expect it to be, but just to illustrate the example of how it initiated. So the initial cluster started sometime early in September when there is a family gathering in some place in Blue Mountain and Collingwood, and from in that particular event, some of the family members ended up in attending another family gathering outside of this region, and then resulted in some of the exposure in that situation. Within the same family, what happened is that one of the child had a celebration, which prompted some of the other groups of his friends to go into a restaurant, and then as a group they all decided to go to a cottage in Tobermory. And then as a result, there are a number of individuals that were potentially exposed and are listed and identified from that Tobermory cottage exposure. And then within the same circle, not knowing the status of the individuals and maybe mild symptoms, another type of exposure, a tree that initiated as a result of a card game that happened in September as well, which resulted in 2 cases already. So based on all of this and the connectivity of all this, the complexity of the investigation and how easily it starts to spread from one family and spreading out to up to a number of other cases, it's one of the another example that we can say that these events, maybe they are not seen as one high risk event, but these are number of low-risk event that resulted in number of exposures to different people, and then resulting in number of positive cases in the community. So to summarize many of these cases, as of yesterday, there are 20 confirmed cases that we have identified, and out of this, we can say is 19 are confirmed and 1 is probable, because we are still waiting the result for 1 individual who is asymptomatic but had been exposure and all the other close contacts are positive, so it's highly likely that this individual will be positive as well, but we're pending the test result for that individual at this time. And right now, 3 cases are already been discharged, and 17 are still being followed up by the health unit. The earliest symptom onset date for this particular cluster was September 5th, 2020. What is interesting is because of a lot of them are close contacts and closely linked to each other, and the age group in this particular category is in this particular cluster is majority of them are between the ages of 20 to 29, and that's what we have found. And majority of the residents are living in City of Windsor. Looking at the epidemic curve of this particular cluster, this is what it looks like. So we have seen a steady flow of cases as a result of this cluster with now a case count of up to 20. And we're hoping that we have reached out to all the individuals. There are other contacts that are our health unit are also following up. And if there's any addition to this cluster, we will report it further. But at this time, this is what it looks like. So in summary, as we have talked always about, high-risk contacts are at a risk of developing COVID, and they have to isolate for 14 days to prevent any transmission. Identification of these high-risk contacts is critical for the containment of the disease. So please, if you are in contact with individuals who can be considered as high-risk contacts, when public health staff are contacting you to collect the information from you of all the high-risk contacts, if we have the right information, we can act immediately and we can contain the disease as best as we can by reaching out to all these individuals. And as always, as we are talking about and we continue to repeat, please reduce the number of close contacts, because that's the critical piece of reducing the spread in the community. We talked about physical distancing, we talked about a number of other measures that is critical, and it continues to be critical. And as we have always said, right now the likelihood and exposure to other individuals is very high. One thing that we can do is obviously we can still do many of the things that we are doing right now in phase 3 in a safe manner. Reducing the number of close contacts, reducing the number of people that you are sharing an indoor space for a longer period of time without maintaining physical distancing. All those instances, it can easily lead to a very high attack rate, as we have seen in this type of community cluster, where the exposures didn't happen in a number of different settings, but high risk exposure in a high risk setting, leading to potentially almost everyone who was part of that event or that cluster. COVID is a highly infectious disease, and it spreads very quickly. We have seen it in our example, whether we are talking about the other congregate settings such as long-term care home and retirement home, it spreads quickly. In a short confined space with many people, the risk of spread is really high. And as a result, private parties and social gatherings, if physical distancing and if appropriate measures are not taken, it could lead to a large number of cases very quickly. It can be a challenge for not only for the people who attended that cluster or that event, but also for the rest of the community. So my recommendation is, these examples is definitely help individuals to make that connection, make that part of their normal activities that many people used to do in the past and are still doing it. We have to recognize that this is not the normal time. This is a difficult time. COVID still exists amongst us, and we need to take action to make sure that we are doing our part in reducing the transmission. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CTV.
Yes, good morning, Dr. Ahmed. I'm just curious, is that student from Amherstburg we talked about yesterday part of that cluster? I noticed there's only 2 between the ages of 10 and 19, but was that child one of them?
No.
No? Okay, do you expect this number to grow in the next few days?
It's hard to say. As I said, we have reached out to almost everyone that we have identified as close contacts, and many of them are already converting. At this point, it's hard to say, but it's hoping, and I like to be optimistic that hoping that this may not result in many more additional cases, and hopefully this is it. But a good reminder for everyone to pay attention to everything that we are doing. Even these many low-risk events can easily turn out into a high-risk event.
Okay, and I'm just curious, is everybody in that cluster sick? Like, are they showing symptoms, or are they full on sick? Or is it possible that even some of them may have tested false positive?
No, many of them are, I think all of them are symptomatic, and it's a good indication. So even when we are talking about someone who has a high-risk exposure, and some people may argue about the whether they are false positive or true positive. The diagnostic technique that we have, that means that they're positive, and secondly, we have a reason to believe that they had a high-risk exposure, and that's why they're positive. So there is no doubt, at least in our mind, that anyone who is part of this cluster is a false positive. I think they're all true positive, and they are being followed up accordingly as a true positive case.
Okay, so there wouldn't be a necessity, I guess, to double test them just in case, right? This is like pure and full, they're positive.
That is correct, yes.
Okay, good to know. Thank you.
Any questions from Windsor?
Did any of the cases from this cluster result in spread like outside of the families and friends?
Not to our knowledge. I think they're all linked to at this time as family and friends, and are limited to that setting. And some of even the other places that were involved, we don't have any evidence for any transmission, and those events are already classified as low-risk events.
Okay, thank you.
Any questions from CBC?
Not right now, thank you.
Any questions from AM800?
Dr. Ahmed, can you share with us, I'm not sure if you have these details, but the family gathering in the Collingwood Blue Mountain area, did this family were exposed to the virus outside of Windsor-Essex, or does the health unit believe that they might have had symptoms prior to going to the Blue Mountain area?
Rob, it's hard to say with certainty, but what we believe is the exposure probably happened outside of Windsor-Essex, but it's always a tough one because the infection could have been acquired 14 days prior to anyone who is showing symptoms. So we couldn't link it to anyone here or any event here in Windsor. So that's why it's hard for us to say that whether the acquisition happened here or in that setting.
I guess going to the age brackets, for cluster number 1, the age bracket was 10 to 19. This cluster is 20 to 29. Do you have concerns with the lower age group that's testing positive for this virus?
Sorry, Rob, I missed you because of some of the noise. So can you just repeat it?
I guess just the age brackets.
Yeah.
Cluster 1 was 19 or 10 to 19. This cluster 20 to 29, the majority of the cases. Are you concerned with how the virus is spreading amongst the younger population here in Windsor-Essex?
Yeah, and I think that's been the trend across the province as well, and we recognize that the younger people may be feeling or having this COVID fatigue now, and they want to go on with their social life, as many of us also want to do that. And they may be feeling that they are, as I said, many of these low risk events, even though that the events are low risk. But if you multiply or if you accumulate those events to a number of events, it can easily lead to more exposure and more high-risk exposure. So I think and again, I want to be very careful what I say. I'm not blaming them. I'm just saying that maybe they don't recognize that how it can accumulate, or how these type of exposure can lead to such a big number. And it just takes one person, and again, the person who initiated, or whoever in any kind of cluster, in any setting, initiate that, it's not a fault of them to expose others. I think what happens is we have to recognize that an individual can be infectious even before they start to show symptom. So even though when everyone is coming into your party and maybe they all are okay, but we don't know what their exposures are, or whether they're incubating the virus, or whether they are exhibiting any overt symptom. If someone is obviously exhibiting any overt symptom, that's obviously, it's a no-no, and people should never do that. That if they have any type of symptom, any social gathering, they should not attend, period. But for those who may have either mild symptoms, or who may be what you can say is pre-symptomatic, or before they start to show symptom, those are the individuals who spread that. So yeah, it is a concern, and I think that's why the messaging is very important, that who it is affecting directly. And when we are breaking it down in terms of the age ranges, and in terms of linking it with some of the benign activities, as many people may see it, that they're not doing anything high risk, they're still their close friends that they know for a long period of time. So I think even events like those, if someone is developing the disease, or if someone is attending those events before they start to even show symptoms, there is still that possibility. So I think we as a community need to be careful and monitoring everything that we are doing, all the activities that we are participating in.
Dr. Alm, a quick one here, but did you and your team have to reach out to health officials in Collingwood along with Tobermory?
We always do that as soon as we identify any individual who are identified as close contact. We have our public health systems have the system of referral, so we send out those referrals to the other health units if someone lives in their area, and that's how they start their follow-up.
Thank you.
Any questions from Blackburn?
I just want to go through the chain of events again, just to make sure I'm clear. So September 5th, they had a family gathering in Collingwood. They went to another family gathering in Windsor-Essex, where a child had a celebration at a restaurant, and then went to the cottage in Tobermory. Is that right?
Yeah, that is right. But there are other simultaneous events happened, and in addition to Collingwood, right after Collingwood, there was another family gathering on September 6th. And then another party or a card game event that happened, I believe it's September 8th. It's too small in my slide that I can't see, so my apologies.
Okay, I just want to make sure I got the chain of events correct.
Yes.
The other question I have for you is, we're getting into the colder weather now, as you know, and more people are going to be doing more things inside. Are you concerned that we're going to see more clusters like this, just simply for the fact that we're going to be in closer quarters?
Yeah, I think that's a concern that everyone is having right now, and we heard it even from our premier as well, that he's looking into these private parties and what to do, including consideration of reducing the limit in social gathering. What does it mean? And obviously, as I said, we want to do what is best for the community, and the community needs to do their part in ensuring that they're also becoming part of the solution rather than becoming part of the problem when these with these type of activities and these type of gatherings. Clearly, nobody wants an increase in the number of cases in the region. Nobody wants to see a second wave, which can devastate an entire community. And I think it would be good to go back to some of the initial projections that many epidemiologists around the world has presented of what it could have been and how many deaths that could have been that could have happened as a result of COVID if public health measures were not implemented. We have good examples from not far from here, even right next door, and that how many people got infected, how many deaths happened in that region. So I think we should not lose that focus, and I think that we are in a good stage at this time with phase 3 reopening, with lots of activities that is happening, and many of the things that we can enjoy right now. I think we like to keep it that way. I like to keep it that way, and we should not go back to a place whether we're talking about a stage 2 rollout or a stage 1 rollout. We don't want that. Nobody wants that. So I think we need to act now to prevent that from happening. And we have heard it from the Premier loud and clear that he would not hesitate to go back to implementing many of these measures again. And as a community, I think we need to be responsible. We need to act now to prevent us from going back to a situation where we have to cut down on our economic and social activities.
Thank you.
Any questions from the Windsor Star?
Hello, can you hear me?
Yep. Yep.
Dr. Ahmed, just to get some clarity, how many cases are associated with this new cluster that you're describing?
I would say 20 cases as a result of this cluster.
In the age range of 20 to 29, you mentioned?
So the summary that we presented, we have 14 of them between 20 to 29, and 2 individuals between 10 to 19, and then 2 individuals between 50 and 59.
So you touched on this on your comments. You mentioned that we have to continue to act like life is abnormal. We are in an abnormal situation. But the reality is that the public is suffering from fatigue with all these measures. It just feels unnatural for many people, and many people are gravitating towards human activity. What can you say to people who are saying that they can't handle anymore at this point?
Well, the first thing that I think what I would say is, I'm also one of them. I want to do my social activities. I want to get engaged with my friends. I want to do many of the activities that I want to. It's not that we cannot do any of that thing. I think what the key question is, how do you do it safely without putting yourself at risk, and without putting others at risk? So there are limitations. It cannot be the same way. We used to gather in large numbers, in tight quarters, tight gathering where, there are a lot of people in there. That cannot happen now. You have to be very selective that who you are coming in close contact with. You have to be selective in terms of which space you want to meet. And then you have to be selective that if you want to plan out something, it cannot happen every day. You have to maybe pick and choose what you can do. Maybe you want to do something in a week time and then, give yourself a break. Look at who else your close contacts are. Come up with some, I know it's tough, but come up with some kind of a contract, like a social contract, that what you would do, who you would hang out with, and what is the obligation to be part of that social contract and social group. So you have to be creative in terms of what you do and how you socialize. And I get it. I'm also one of them. I like to do more social gathering, more activities, but I'm not. I think we all have to take that responsibility and do our part in a very responsible way and ensure that we are not contributing to the spread of COVID-19.
Thank you.
Any further questions from CTV?
I'm good today, thanks.
Windsorite?
No, thank you.
CBC?
No, thank you.
AMA 100?
No, thanks.
Blackburn?
I'm good.
Windsor Star?
I'm good.
Okay, thank you, everyone.
Thank you.